Hello, my name is Karen Kiefer. I'm a nurse practitioner at Cooperman Barnabas Medical Center, Stroke Center, and today I'm here to talk to you about strokes. Strokes are truly a medical emergency. It's really important for us to think about calling 911 immediately because what matters is the amount of brain that may die every minute that you do not call 911. Millions of brain cells can die when a stroke is untreated. And for every hour that people wait before calling for 911 and coming to the hospital, they can lose about 2 million brain neurons. The sooner we can identify the stroke, the better the outcome, the more opportunity that we can intervene and perhaps even stop the stroke. What really is a stroke? A stroke is an interruption of the blood flow to the brain that causes damage to the brain by the lack of oxygen and nutrients. And depending on which part of the brain is affected, depends on what your symptoms are. It's really vital to know the signs and symptoms of the stroke and to rapidly activate 911 to decrease the amount of damage and the chance of disability. Many opportunities are lost when you don't call 911. Even if you bring yourself into the hospital, you can be sitting in the waiting room and have a stroke right then and there. Now, there are two different types of stroke, ischemic and hemorrhagic. And I do want you to remember that stroke is the leading cause of disability in the United States and the fifth leading cause of death. How can a stroke be treated? It starts with rapidly accessing EMS and arriving at the hospital within 3 to 4 hours within the first onset of symptoms. The earlier, the better. Immediately, you're evaluated by a stroke neurologist and you'll have a CT of your head to take a look to see if there's any blood inside your head and to determine if you're eligible for any specialized clot-busting medications. If a large blood vessel is blocked, some people may be eligible for a special procedure that removes the clot. And the rapid identification and access to the emergency medical system provides you with the best care. The ideal scenario is calling 911, having EMS call ahead and alert the hospital, and the team will be there waiting to evaluate you. So therefore, we waste no time. Now, the two different types of the stroke are ischemic as well as hemorrhagic. An ischemic stroke is caused by a blockage within the artery that stops the circulation to that rupture or a rupture of an aneurysm. 13% of strokes are this type. Now, the causes of an ischemic stroke. There's a few different causes for this type of a blockage. One is a thrombus. When a blood clot forms within the blood vessels and blocks the cerebral arteries to that location, that is what's called a thrombus. Now, an embolus is a little different. It's a traveling particle. It could be a blood clot, it could be a piece of cholesterol or plaque, it could be debris from an infected heart valve that broke off, and it lodges and blocks the blood vessel in the brain. And there are also some blood clotting disorders that increase in clot formation. And when the clot travels, it can block the circulation to your brain. Now, everyone talks about a TIA, and many call it a mini stroke, but it's a little bit more important than that. It's really a warning sign of an impending stroke. It's when the arteries are briefly blocked and you have temporary symptoms of a stroke. It is a medical emergency, and you should still call 911, even if your symptoms have resolved. It's vital to go to the hospital to determine what caused this so that we can prevent a stroke in the future. Because it really is a sign of an impending stroke. We don't know when, within 24 hours, months, years, any time, even minutes. So if we can figure out what caused the TIA, we need to prevent a stroke. Now, the symptoms of an ischemic stroke are a sudden onset of any one of these symptoms. And the American Heart and the American Stroke Association have coined a phrase called "be fast" to help us remember the symptoms. And every letter stands for something. B stands for balance, if all of a sudden you're off balance or leaning to one side. E is eyesight, double vision, blurry vision, or if you can't see out of one or both of your eyes. F is a facial droop, or if you go to drink something, it comes out the other side. A is arms or legs, numb or tingly, or you can't feel it or move it. S is speech, where your speech sounds funny or you're saying the wrong word in response. And T is time to call 911. Now, the causes of hemorrhagic stroke are slightly different. They could be caused by high blood pressure, aneurysms, an AV malformation, or blood thinners. Now, an AV malformation is a cluster of abnormal blood vessels of both arteries and veins. They almost go into like a ball. And when the pressure increases, your blood pressure, they can leak and cause bleeding inside your brain. Now, the symptoms of a hemorrhagic stroke are slightly different. It's the sudden onset of symptoms with worsening over time. The worst headache of your life, neck pain, light sensitivity, nausea, vomiting, a decreased level of consciousness or becoming exhausted, tired, or even looking like you fell asleep, or being difficult to arouse, dizziness or confusion. And some of these symptoms you won't know yourself. The people around you will see them. And please call 911. Now, many strokes are caused by high blood pressure, both hemorrhagic and ischemic. And what really is high blood pressure? Blood pressure is built up in the arteries within all the arteries in your body, and it affects all organs and systems. And when the blood pressure is high over time, it increases the stiffness of your arteries. It weakens the walls, and it increases your risk for the blood vessels to tear, called a dissection. Now, when it tears, there could be cholesterol buildup in the tear, and it could also be a place for blood to coagulate and join and form a clot. If you take a look at both of these pictures, you could see the tear right here where the vessel walls and blood gets trapped and a blood clot forms. And here, you can see the cholesterol buildup. See how different it is? See how it narrows the blood flow? It can increase the blood pressure. It could destabilize the plaque. All of these things can lead to a stroke. An AVM, like I alluded to before, affects all arteries, including those in the brain. It could cause aneurysms, and arteries can bleed and place pressure on the brain that interrupts blood flow. Arterial venous malformations also bleed when the blood pressure is too high, placing pressure on the brain, interrupting blood flow. If you can see this picture here, you see how it almost forms almost like a ball and is fed by a specific artery. And as the pressure increases, it leaks and causes blood on the brain. So how do you know what type of stroke you had? We start with testing and evaluation examination. A CT of your head, an MRI, and other testing helps you determine the type of stroke you had. A neurological examination with specialists, and a focus not just on identifying the type of stroke, but finding out why it happened and what is needed to prevent future strokes. The symptoms that you have are determined by what part of the brain is affected. So what you expect when you arrive at the hospital. From the minute you arrive, you're going to have a team of people working on you to try to intervene to stop this stroke. You'll have a CT of the head and blood work and EKG. Speech therapists will come by and do a swallowing screen, or your nurse will. Physical therapy and occupational therapy will see you as well. You'll be placed on a heart monitor or telemetry to look for any heart rhythm problems. And they're going to do neurological checks to compare how you are within so many hours. They're going to be doing your blood pressure and your vital signs and take blood, and frequent education on strokes and stroke preventions. From the very beginning, you're going to meet with a social worker and a case manager. The goal is to help you improve your functioning back to as normal as possible and to prevent strokes. And should you need any placement in any rehab centers in the future as we continue with your testing and your workup, the case manager and the social worker are already established, and we understand what type of insurance you have and perhaps even some needs that you may have. Now, although rare, COVID-19 and strokes are connected. Once you have COVID, you can be at risk for both an ischemic or hemorrhagic stroke. Strokes can occur 1 to 3 weeks after COVID-19 and may be the very first symptom that you have COVID. It causes the strokes by placing your body in a hypercoagulable state. Now, what does that mean? It means that the blood clots too easily. It also puts you in a pro-inflammatory state where your body systems are inflamed. And when your body systems are inflamed, it can lead to increased clotting and bleeding. Strokes caused by COVID-19 still have the same treatments as other strokes. So it's not like anything different is going to be done. The real take-home message is, if you have any new or sudden signs or symptoms of a stroke, call 911 immediately. Don't wait. If you have COVID-19, monitor yourself for signs and symptoms of a stroke during the infection, as well as after you recover, too. Remember, time is brain. Recreational drugs such as cocaine, amphetamines, methamphetamines place you at risk for a stroke as well. And they do that by both chemically and other mechanical ways, like vasospasm, clot formations, and injury to your arteries. And the chemical reactions can cause high blood pressure, hyperthermia, or really increased body temperature, or seizures. Recreational drugs can cause a stroke, an aortic dissection, an aneurysmal rupture, heart arrhythmias, vasculitis, myocarditis, myocardial infarction or a heart attack, and long-term use of recreational drugs impairs cell oxygenation and blood flow and increases clot formation. Because for some people, chronic marijuana use can place you at risk for stroke. The cerebral arteries can narrow and blood supply can be stopped or interrupted. And continued use can cause the blood vessels to stay narrowed. That way it deprives the brain of an adequate blood supply. And blood vessels narrowing sometimes improves, but only when marijuana is stopped. The heart and the brain are truly connected. Almost every body system, or I'm correcting myself, every body system is interdependent on each other to work properly. Many strokes are caused by atrial fibrillation. It's an irregular rhythm that increases the chance of a blood clot forming in the heart, which may travel to the brain and cause a stroke. Only one episode of atrial fib is enough to cause a stroke. And sometimes atrial fibrillation is elusive and very difficult to find. Further testing and monitoring may be recommended before any blood thinners are ordered. How can we find out what caused my stroke? Again, and I'm repeating myself to help you remember these things. Imaging, such as a CT of the head, an MRI, an MRA, a CTA. We're looking for causes, blood tests, cholesterol, hemoglobin AC, and special tests for clotting disorders as well. an echocardiogram, looking for reasons for blood clots or anything that may cause the stroke. Carotid Dopplers, which is an ultrasound of the carotid arteries in your neck to look for any narrowing or buildup of cholesterol. And you're going to have multiple specialists. You're going to have your neurologist, your cardiologist, your hematologist, sometimes even a neurosurgeon besides the primary doctor. Stroke treatment and prevention is truly a team effort, and as a member of the team, we all have responsibilities. And should you have a stroke and you are the patient, your responsibility is truly knowing the signs and the symptoms of a stroke, as well as your personal risk factors and lifestyle modifications. To participate in your rehab and to adhere to your medication, to take it as prescribed, and should you have a side effect, to let the prescriber know. Follow up with your healthcare providers, exercise, control your blood pressure and your blood sugar and your weight as well. Understand what a stroke is, how to recover, and how to prevent future strokes. We, as healthcare providers, are responsible for treating your current stroke and to try to prevent future strokes by prescribing medications, information, follow-up appointments for the treatment of risk factors, and answering all your questions. And the case manager and social workers assist you with information regarding rehab facilities, visiting nurses, or providing other resources as well. It takes a team to prevent strokes. Now, the team is comprised of the primary care provider, the stroke neurologist, the cardiologist, the registered nurse and the nursing assistants, the speech and language pathologists, occupational physical therapists, case managers, and social workers. I want everyone to think of stroke as a medical emergency because it truly is. What you do matters. How quickly you react matters. It's okay to call 911 and be wrong. Because if you are right, perhaps we can intervene and stop the stroke and decrease your cause of disability and prevent a future stroke. I want to thank you for listening to me today, and I want you to take this seriously. Let's be healthy together. Let's prevent strokes.